Welcome, everyone. Thank you for joining us today for the California Improvement Network webinar. My name is Hunter Gatewood. I'll be facilitating on behalf of the network and the California Healthcare Foundation. Your line is muted. If you have any logistical problems, if you can't get onto the online portion or need anything, please use chat to the host. And at any point during the webinar when you have questions, I'll say this again, but we'll take chat to get your input and feedback. We do want you to participate, but we do need to keep all the lines closed for just noise and audio control. So I'll wait maybe 30 more seconds, and then I'll get us started. Thank you again for being here. Hello, again, my name is Hunter Gatewood. I am a consultant who works for the California Healthcare Foundation and helps manage the California Improvement Network. I will tell you more about the network at the end of the webinar, and right now I want to get right into it. This is the third hour webinar discussion we've had in a short series here on alternatives to face-to-face visits. The other two topics, we'll tell you how to access those recordings and resources at the end of the hour here, but those two topics were the top 10 ways to get the most out of your patient portal, and also a really important pilot on texting for patient engagement by a Medi-Cal health plan here in California. So those are the other two topics. Now we're at 3 of 3, and we're going to talk about telehealth and eConsult, how to collaborate with patients and between specialists and primary care provider organizations to integrate care and improve access for patients to the care and services they need. We are recording this session. The slides and recording will be posted with the other webinars I mentioned and a whole other series of webinars that we've been doing over the last couple of years to the CIN webpage at the California Healthcare Foundation main site. Again, if you need to ask a question, if you're having problems with the webinar accessing both the audio and the online portion, use the chat to get some help on that. If you have questions for speakers or comments you want to add to the discussion, use chat at any time. We will sprinkle those in throughout the discussion for the short specific questions about what's being presented, and then we'll have time at the end to get into more discussion with our three speakers. As the webinar ends today, there is a survey where we ask for your input on how the webinar went, how useful it was to you, ideas for future topics, and we do use those, look at those very seriously and use those to make sure that we keep the presentations we do here, make them as effective as possible for your work. We know you're busy and we value your time and therefore your input. So as we get started talking about telehealth and eConsult, these are the most basic definitions I could find for us. Telehealth is the provision of healthcare remotely by means of telecommunications technology, also called by many people telemedicine. And then eConsult is bidirectional electronic communication between primary care and specialty care providers to improve access and quality of care. The speakers, you should feel free to complicate those definitions or challenge them as you go, but that's what I came up with, trying to be short and sweet and clear about what we're going to be talking about today. All right, and now it is my pleasure to introduce our speakers. We have Kelly Cosano from Partnership Health Plan of California. She's been with Partnerships since 2013 and has helped develop their telemedicine program she'll be sharing from the ground up, growing it from 3 sites to what is now 23 sites that participate. She worked before Partnership as a medical assistant at an ophthalmology practice where she worked directly on patient care. She brought this experience and expertise to the telemedicine program. She also serves on 2 internal work groups at Partnership whose focus is to expand specialty access throughout Northern California in their large geographic network that they serve. Dr. Bill Hunter is the medical director for the Open Door Community Health Centers in Northern Humboldt County. He served in that role since 1998. Prior to that, he was medical director of the Redwoods Rural Health Center in Redway and was on staff at Southern Humboldt Community Hospital, now called Phelps Hospital, doing family practice and emergency medicine. He says that as a product of the 60s, he became interested during his education and practice in the alternative cultures of those years and the possibilities for new types of medical institutions to serve local communities. And then we have Dr. Javed Siddiqui. He's the co-founder and chief medical officer of Telemed2U, a 100% telemedicine-based multi-specialty clinical practice. He's been actively involved in telemedicine since 2002 and founded Telemed2U in 2011. Telemed2U does work in implementing telemedicine services and programs with hospitals and outpatient clinics. Telemed2U received an Innovation Award in 2012 from the Agency for Healthcare Research and Quality, AHRQ, which most of you know. Prior to Telemed2U, he was the medical director at the telemedicine program at the University of California, Davis. And he's an infectious disease physician and is also a recognized medical technologist who served as the first medical director of California's Institute for Science and Innovation, the Center for Information Technology Research in the interest of society. And in addition to all of that, he advises and serves on the board for multiple telemedicine and healthcare tech companies. So these are our three experts, and what we'll be doing really over the next hour is getting into the weeds, the wins, the advice that they have from this partnership that they're going to dig into. And so before we get to that, though, we want to know a little bit about your own experience and interest in telemedicine and eConsult, what you're already doing, what you hope to do. So Helen's going to take the control here, and please play along with us and complete this poll. It will help us know who you are and how we can make this presentation really work for you. All right, so you should see the poll on your screen. Complete this question. Helen will close it, and then we've got one more question for you. Great, thank you. Oh, that's interesting. Okay, so wow, people, the majority, almost half of the folks that have joined us are going to begin. They are not doing telehealth or not doing much at all at this point, and we'll be starting it in the next year. Well, that's great. I'm really glad. So this is perfect timing for you for this topic. Thanks. All right, second question. Okay, you should see the second question up. All right, so people are really interested in business case, how to make this work operationally. All right, that's great. Makes me glad we're starting with with Kelly as the lead presenter for the payer and funder perspective. That's where the business case lies for this partnership in large part. All right, so poll is over. Thank you all for participating. This is really helpful to know. And we'll go on. So we'll have Kelly will begin, but because these three leaders from these three partner organizations are working in close partnership, as they'll tell you about, this is going to be a discussion where Kelly and Dr. Hunter and Dr. Siddiqui all collaborated on this first set of slides you'll see about the program, and Dr. Siddiqui and Dr. Hunter will both probably chime in as she goes through. So Kelly, I'm going to go ahead and start moving through the slides, and please take it away.
All right. Well, good afternoon, everyone. Just to start a little bit to tell you all about partnership as an organization. We're a nonprofit county organized health system providing a Medi-Cal managed care network for over the 500,000 members that are assigned to us in the 14 counties that we serve. PHC's mission is to help our members and communities we serve be healthy. So this includes ensuring adequate access to specialty care services. And given the remote locations of our primary care providers in our northern region counties and a shortage of specialists in many of the areas, we believe that a strong telemedicine specialty network was an important strategy to provide access to specialty services. So as you can see from the map, we've broken our counties up in terms of north and south, the burgundy being the north and the blue being the south. The map also shows our 4 regional offices that are located in the communities that we serve. And for the members in these communities, telehealth, it's not a nice to have, it's a primary need to avoid time and cost to travel hours to see a specialist. And so we currently have 2 programs within our telehealth umbrella. The first is our synchronous video program with Telemed2U. And we started this program with them in August of 2014. We just started with 3 primary care clinics. But in order to get started with these 3 sites, we needed to have an experienced and reliable partner to provide this service to our provider network and our members, and who can meet the following requirements, which are 1, adequate experience, 2, we were looking for a pay-for-time model versus block scheduling, and we really needed a partner, not just a vendor. And through an RFP process, we identified Telemed2U as a vendor that could meet those requirements. And one of the most important aspects of the partnership we have with Telemed2U is we engage with them together as a partner with sites with implementing the program. We onboard each site as a team, and we at Partnership provide claims and administrative information, and Telemed2U provides their telehealth experience, expertise, coupled with the technical piece as well. And since our program launched in August 2014, we've completed over 2,300 video consultations with service available to areas to over 90,000 of our members. We also offer, I'm sorry, go ahead, Dr. Siddiqui.
I'm sorry, Kelly, I just wanted to jump in. I think it can't be understated how valuable the dedication that Partnership Health Plan made to telehealth. Having worked in telemedicine for a number of years, I actually started doing my first telehealth consultation in 2002. It's incredibly rare to find a health plan that from their senior leadership all the way down to their individual clinical sites has truly adopted the belief in telehealth and the concept that this is part of the solution to increasing access to medical specialists. I think that's incredibly important because that foundation is really the reason for the success of this program. As Kelly mentioned, we were Telemed2U, we were chosen through an RFP process, but I think that more than just placing an RFP out, I think prior to even doing that, Partnership clearly made a commitment to telehealth as this is the solution we're going to embrace and the solution that we're going to make. And I think that is one of the keys to the success and really speaks volumes to the leadership and to the program under the direction of Kelly and the team there.
Thank you, Dr. Siddiqui. And along with that, we offer a telemedicine coordinator support grant to help assist our sites in the coordination, development, and implementation of specialty telehealth services. So this grant aids in offsetting the costs associated to maintain and grow a site's video telehealth program. And any of our contracted PHC providers with operational equipment are eligible to apply, and they will receive a startup cost initially, and then will receive subsequent grant payments determined by a site's volume of visits within a defined time frame. These are the current specialties that are offered within our program with Telemed2U. It varies by site for the specific specialties utilized, but the most specialties used are psychiatry, endocrine, neurology, Hep C treatment, and rheumatology.
And I think it's also worthwhile to note that Partnership surveyed all of their sites and said, what do you all want? What are your top 3 needs? Now, obviously, they fluctuate over time. But again, starting this program from ground zero, I thought that was incredibly innovative to get the feedback that the health plan did, as opposed to just saying, we're going to roll out X, Y, and Z. They actually surveyed the sites, said, what would you like? And then we did and what we did was work with Partnership from the Telemed2U standpoint in order to say, okay, we'll introduce these first, then this will be the first phase, this will be the next phase, and there was clear communication to all the sites. This is how the implementation was going to occur. So there weren't any undelivered or unmet expectations.
And this next slide, the graph shows the utilization of our program. As I said before, as you can see, endocrine is the most popular specialty, followed by rheumatology, psychiatry, and neurology. And this is just a snapshot in the past calendar year.
I think it's very important to also point out with regards to hepatitis C that Partnership Health Plan and I really have to acknowledge Dr. Marshall Kubota as well as Dr. Moore for establishing a clear-cut guideline on how to treat hepatitis C. So one of the reasons why you see so many, over 160 patient visits in hepatitis C, is that there was a clear-cut guidelines to say, this is how we're going to treat hepatitis C. These are the patients that we're going to treat who have hepatitis C. So it was an incredibly valuable program, and for some of you who might be wondering why hepatitis C is among the most popular, that's the reason or rationale.
Yes. And this next slide shows the average time between when Telemed2U receives the appointment request to the actual date of service. So as you can see, all of the specialties listed average less than 10 business days from request of appointment to the actual date of the visit. And this is also a snapshot within the past calendar year. And next we have eConsult. So eConsult is our asynchronous program, and we've contracted with SafetyNet Connect to provide our network and members with better access to specialty care by using the system. SafetyNet Connect is a joint venture between 2 companies, between Net Chemistry and Elm, and they provide web-based health solutions to the public and private organizations serving the underserved. So eConsult is a web-based system that allows PCPs to submit clinical questions securely to specialists. So PCPs can ask the specialist about a treatment plan or discuss a difficult case that may or may not result in a specialty referral. And we launched this program with SafetyNet Connect, Open Door, and Telemed2U in February of 2016. We've completed over 400 consults, and we have service available to areas to 30,000 of our members. And PHC, we fully fund this benefit by funding the platform and as well as the training costs for both the PCPs and the specialists.
And if I may, this again shows Partnership Health Plan's true commitment to telehealth and having an overall roadmap. As you all can see, Partnership engaged with the synchronous telemedicine initiative first, and then as we brought up the synchronous telemedicine program, Partnership then engaged with SafetyNet Connect, who's a wonderful partner, to offer e-consultation. Now, one of the key things with e-consultation is that 2 things. One, e-consultation allows a primary care physician to ask a medical specialist a question as opposed to doing a full-scale consultation, or as opposed to something that most people are very familiar with, a curbside consultation. With eConsult, the medical specialists at Telemed2U are able to get some medical records are able to document their response, and that response through the SafetyNet Connect platform then becomes part of the medical record. So you have a clear-cut, delineated response. Now, one of the features that we're very grateful to partnership to be part of this program is that both the synchronous and the asynchronous piece work incredibly well together. So you can imagine if, as an infectious disease physician, I have a hepatitis C patient, we see them as a synchronous consultation, and we initiate treatment based on the Partnership Health Plan guidelines, and then there's some issue. Patient lost their medication, patient may be having some nausea, as opposed to waiting for 2 weeks for a follow-up visit. That primary care physician can initiate an eConsult, which comes directly to our providers to ask, what should I do? And they can have that immediate response. And I think through TeleMedToU's partnership with Partnership Health Plan, what we have are the same physicians who are providing the synchronous consults doing the e-consults. So there's a continuity with regards to both sides of the equation, whether you're a synchronous telemedicine or asynchronous telemedicine.
And these are the current specialties that we have live within the eConsult system. So as Dr. Siddiqui was saying, we've contracted with them for synchronous as well as our eConsult system. We've also contracted with a local neurology practice in Humboldt County to serve the open door patients as well. This graph shows the percentage of eConsult closures. So the blue represents consults closed as patient needs addressed, meaning the patient's needs were met and a face-to-face referral was not needed. And also the percentage of eConsults closed as a refer to face-to-face is shown in orange. So this is meaning the patient needs to have an in-person visit with a specialist. But since we're partnered with TeleMedToU for both eConsult and video, many of the face-to-face referrals may result in a video consultation.
And if I may jump in, again, I think this is important to really go through this data, because let's take endocrinology for an example. You would look at this and you say, wow, 36% of the e-consults actually resulted in a telemedicine referral. Well, the true response is that the primary care physician initiated a question. With the TeleMedToU specialist being able to review that response, what they were able to then say is that this is a complex question, and in order to appropriately answer your question, I need to see this patient in a full telemedicine consultation. But in order to prepare that patient for a telehealth consultation, could you please get these labs? So one of the true advantages of an e-consult is that even if the patient is going to a synchronous telemedicine visit, they come to that visit far more prepared, for the lack of a better term. So as opposed to referring to a bricks and mortar environment, the patient comes in, go, aha, I see, but in order to better address your problems, we need to order these 5 labs. Why don't you get them? I'll see you back next month. Well, by having eConsult through the SafetyNet Connect platform, what the primary care physician is able to do is able to get that response back immediately, and for us to get those labs done. And then when the patient comes for a synchronous telemedicine visit, all of that information is there. And that was my rationale for saying better prepared. Now, as I said previously, some of these questions may be a follow-up from a synchronous visit, and some of these may be actually in the infectious disease realm, which I can answer very closely because that's what I do for a living, is the fact that it may be, do I treat this? What's the best treatment option for community-acquired pneumonia? This is the patient's urine analysis. What should I do? I'm able to look at that and respond back to the primary care physician. So it offers both an immediate response and a solution, but can also be a very nice way of communicating with the primary care to have a much more complete initial telehealth consultation.
And what you're getting at, Dr. Siddiqui, gets back to the business case that people are interested in, and well, and efficiency, all of this, of course, but that handoff between eConsult and a telehealth visit or not a telehealth visit, the fact that eConsult can help determine the need or what the prerequisites are, like you're saying, you need these labs before we actually connect you live to a specialist. I think of that as supply and demand management, which is really important in terms of efficiency business case, not paying for services that you don't need, that your patients don't need, not driving the patients crazy by making them go back to multiple visits or take too much time. But I'm impressed by the seamlessness of this, and this is why we wanted to feature this partnership versus a lot of other ones that are going on. But just what you and Kelly are describing is really exciting, the way that the flow has been figured out to help eConsult and telehealth function well together.
Thank you. I think that's a great overview of what we've done. But I cannot stress enough that the reason why this is seamless is because of Partnership Health Plan's dedication to do this. It was their direction, and it was their decision to do this. And this does not happen overnight. This doesn't happen in a vacuum. It takes the commitment and the leadership of a health plan like Partnership Health Plan, the commitment which they made, both in terms of resources as well as in terms of personnel, in order to make this happen. And when it does occur, this is what we always hope for in telehealth. And this is why we have the data that we have.
And I think, among the benefits that we had just discussed, these are some of the expected benefits that we've seen. Obviously, faster access to specialty care, decrease in unnecessary or inappropriate specialty referrals. There's an improved screening process for face-to-face, and a broader scope of practice for the PCPs as well. And as well as for the patients, they're not having to travel, spend their time to go to a specialty visit that may not be needed, that could be taken care of within the eConsult system. And this is the last slide of my presentation, but this is a map, is a representation of the video telemedicine and eConsult sites combined within our program. And as you can see, our telehealth program spans across 9 of the 14 counties that we serve. So by offering telemedicine to our clinics, we have expanded access to our members and we continue to work hard to bring quality health care to Northern California through our partnerships with TeleMed2U and sites like Open Door as well.
Wonderful, thank you, Kelly, and you set me up perfectly for this transition. I appreciate that. So from 2 of the perspectives, so again, the health plan payer perspective and the specialist and specialty telehealth service provider perspective, we're going to turn to the perspective of one of the leading primary care organizations, this primary care clinic, Open Door Community Health Centers, and their medical director, Bill Hunter, who's on the line with us as well. And for now that we've covered all the kind of the really good overview and all the different pieces of the program, we want to hear from Dr. Hunter about his clinic, and then about the impacts and kind of what it's like being in the primary care end of things, both for the primary care providers and also from patients and families, and then any advice he may have for folks wanting to get this started who are sitting in a chair like his from the primary care provider perspective.
Great. Can you hear me okay?
Yes, sound good.
And there's no video, right?
No, there's no video. We decided not to do that.
I think that's a really good idea. Yeah, so Open Door Clinic, we're a FQHC. We've got 13 sites, as you can see there. We're all over Humboldt and Del Norte counties. We're probably, we don't have precise figures on it, but we're at least a third, and we're probably getting close to being half of primary care in Humboldt and Del Norte counties. And we have been also grateful to Partnership Health Plan for helping us with this eConsult effort that, as mentioned, has been going on for a year. So we started with, they did survey us, as was said before, and we started with the specialties that we didn't even have locally. So endocrinology and rheumatology. At the time we started, there were 2 rheumatologists who both left town at the same time. And there's no endocrinologist, has not been an endocrinologist in Humboldt for a long time. Then more recently, dermatology has been very impacted, and they stopped seeing Partnership Health Plan patients here local. The local dermatologist did. We're also interested in neurology. It's hard to get people in, but the choice we made was to, every time we can, to try to contract, try to make arrangements with local specialists. And just, it seems like it makes sense to us if someone's going to do an eConsult with us and then refer for a face-to-face visit, that rather than starting all over, if we've already had that relationship with the local specialist, we'll do that if we can. So those are the main ones. Was well, I guess we've had pulmonology a little bit too, and the biggest ones we've been using have been endocrinology and rheumatology and dermatology. Now for our data looks like about half, well, you saw some slides before, and that's how it is for us. About half of the referrals we make can be closed without the patient going face-to-face. And that's a huge, big benefit for our patients who don't have to travel, for one thing. And even in the local, for the local effort, that our local neurologists are very impacted. And if we can take care of half of our questions without the patient going and faxing records and, you know, waiting 3 months and all that, then it's all to the good. Plus it enhances our relationship with our patients, and it's educational for our providers as well. It took us a couple of tries to get it right. I'm not sure what kind of detail this audience wants to hear, but one of the things, the way the eConsult system is set up, it's on this platform, Safety Net Connect, and there's a website that you go to and enter your questions and upload your data to. And then the specialist is pinged, and the specialist goes on that website and responds back. And when we first did it, we tried to train all our providers to go on the website, and the advantage of that would be that the provider could have an easier back and forth with the specialist. But we couldn't really make it work. The providers just hated leaving their workspace and going off to a different thing, and they would not do it, and they would not look at the results when they came back, and they were grumbling about it all the time. So the way we did it now is we have our referral coordinators do all the negotiating of the website, and they copy the specialist comments back into the provider's in-basket in our normal medical record. And then we communicate with the coordinators when we're satisfied with that particular consultation. And that's worked fine. We have lost a little bit of the ability to have that relationship, but there's a much better uptake. We've been very, very pleased with it. The one thing that's been we've been using more and more of has been the dermatology. Of course, they can't do, you know, biopsies and surgery and so forth, but for puzzling rashes, of which there are quite a few, we've gotten very timely and very helpful suggestions back from the dermatologists. And likewise, especially too. I mean, the data that you shared with telemedicine visits, you know, kind of computer-to-computer telemedicine visits within 10 days or so, but these eConsults are back a lot of times within 1 or 2 days. And it's so huge benefit to be able to tell our patients, you know, well, I'm going to check with the specialist and I'll get back to you and see what you need to do next. Well, I do believe that this has the potential, this whole platform has the potential of making a huge and a real impact in the access to specialty care in our remote area here, and areas where that are kind of where specialists are hard to get into. So we're working now with Humboldt, with St. Joe's Humboldt Medical Group. That's the kind of the foundation through St. Joe's Hospital that employs a number of specialists. We're trying to get a number of other local specialists to come on board. We want to stay with our local specialists if they're willing to do it and if they're available to us, and for reasons I already mentioned. If they've started with the patient and then they can convert it to a live interaction, then that seems like a plus to me. It's always these things always take longer to do than I want. I always get impatient, but I think there's movement, and this whole last year has been pretty good using the telemedicine to you gang and the local neurologist and being supported by partnership. It's a little funny for us, our providers, to have a situation where that you only have that available to certain payers. So it's kind of an odd thing for me to tell my Blue Cross patient they have to drive to Santa Rosa to see the rheumatologist when I can have the partnership patient do a telemedicine to you visit. But I guess that's just how it is for now in this transitional phase. So yeah, I think it's been great. I've been a champion for it. I'm going to keep pushing and see if I can expand it as much as we can, because I think it works really well.
Great, thank you. Let's see, if before we move to Dr. Siddiqui, any further insights he has, any recommendations from you, Dr. Hunter, or from the other speakers for primary care organizations, not the payer, not the specialist, but the primary care organization getting started? I mean, you said, Dr. Hunter, it takes longer. It always takes longer. It's a developmental process. Any other ideas or tips about getting started with telehealth? As we heard at the top of the hour, for almost half the people on the call with us are starting telehealth within the next 12 months.
Absolutely. It's Dr. Siddiqui. I'm happy to weigh in. Dr. Hunter, it's always good to hear from you as well. And I just want to say to Dr. Hunter's commitment to supporting eConsult, matter of fact, I just responded to an eConsult from Dr. Hunter. So that's his commitment to the program. With regards to starting telemedicine, and I think this goes a little bit into my slides, I can't, and I'd love to get Dr. Hunter's viewpoint on this. I feel that when people start telemedicine, they always think about the box. They always think about the equipment. They always think about the platform. And that's nothing to take away from the wonderful platform that SafetyNet Connect offers, or the wonderful boxes that the many companies make. But the key to a successful telemedicine program is the operational workflow. And I think if you're a clinic who's looking to be in telemedicine, working in telemedicine, bringing telehealth services to your clinic, you have to invest in it from the operational standpoint. And Open Door has done just that. They have an incredible operations team led by Mia Hofberg, who just does an incredible job. And I'd love to get Dr. Hunter's viewpoint from the inside, because that's what I see from the outside, is that there's just never enough investment in the operational aspect of telehealth.
As far as the in-person telemedicine stuff, when the patient is in front of on one end of a monitor and the specialist is on the other end, the hard part really is the choreography. I mean, the technology, when we started telemedicine, we had big elaborate systems, but as we do more, it's not very different from Skype or any of those things. It's a little bit more formally set up in our exam. We have an exam room that's wired in for that. But the hard part is getting everybody there at the right time and getting the equipment, monitoring that. And to the extent that we've had success, it's because we've gotten one of our coordinators, Darlene, who sort of takes it on. It's like her primary job is to do the scheduling and to kind of hound the patients to be there on time and make sure they're where they're supposed to be. And we found that we had to have a dedicated person doing that, because if we were just trying to do it with any of our MAs or any of our people, it would just always get fouled up somehow. So that, from that point of view, and then also from the to get provider buy-in, it's probably helpful to have a clinical champion. There's a kind of a lot of, as far as the eConsults were concerned, there's kind of a lot of skepticism at first, and I did quite a bit of salesmanship. I did a lot of talking with my providers and showing them how, just examples of the kinds of things that I was able to do, and it sort of gradually got uptake. Once they did it a few times, they could see the huge benefit. Then we're going to get over the hump, and then the providers buy in. But as far as the telemedicine visits, the choreography is always the hard part, and someone's got to kind of own that job and really manage it.
And Dr. Hunter, if I may ask, how difficult was it for the organization like Open Door to invest in that? Because obviously there's an investment in having an employee to do that, as well as the technical aspect of it. I mean, you all are a large organization. Not only do you have dedicated people from the coordinator standpoint, but you've made an investment in telehealth infrastructure and IT support. How difficult was it as an organization to get all of that going internally?
Well, we've been doing it for a long time, and it was a pretty big, and I don't really know in terms of the financial commitment. I know that 10 years ago or 15 years ago, however long ago that was, we had a much bigger infrastructure thing. We took over this whole clinic, and we called it Visiting Specialists and Telehealth Center. We had some specialists coming to see people there, and we were doing quite a bit of telemedicine out there, and we were acting as both a spoke and a hub. And I think for getting that started, as I recall, there's quite a bit of grant funding, but I think the key there has been that our executive director and our leadership team has been kind of on the forefront, and we sort of like technology, and we like to be on the forefront of things, and it just makes so much sense that if you can, rather than driving to San Francisco and have, a doctor look at you for 10 minutes, if you could do the same thing across a thing and save all that drive time. So we're very motivated, and I think we got quite a bit of grant support going in. We did some partnership with UC Davis for a while, and I don't get involved that much with the money stuff, but it was a bunch of commitment, and we've been at it for a long time.
Yes, you have. I had the pleasure of working with you all when I was at UC Davis, and I just wanted to get that across. It really does take a commitment on the sites, on the primary care site, to realize that that commitment is needed, just like it is on the health plan side, in order to have a successful program.
Great, thank you, gentlemen. I'm going to go ahead and turn to you, Dr. Siddiqui. I'm going to show you have this nice illustration of the partnership, and I know you have more reflections on the ecosystem and how the partnerships work.
Thank you so much, and thank you again for the opportunity to be here. It's great. Dr. Hunter said exactly why I got into telehealth. I am a disciple of Dr. Tom Nesbitt at UC Davis. He was my mentor and my teacher in telemedicine, and I don't think we would have the degree of telemedicine that we have in the state of California had it not been for Dr. Nesbitt, and I always want to recognize his efforts. When I started doing telemedicine in 2002 was exactly that. I was an HIV provider at the University of California, Davis, and I had patients driving 3.5 hours one way to see me. And my response is, I am not that good. You do not need to spend 8 hours for a 15-minute office visit for me to tell you your HIV medications are working and keep taking them. There had to be a better way. And Dr. Nesbitt was incredibly open to me coming in and starting to do HIV through telemedicine. We started that in 2002. But the reason why I tell that story is that at the end of the day, there has to create what, for lack of a better word, what I call the telehealth ecosystem. You have to have an ecosystem in order for this to flourish and to grow. And back then, we really didn't know what to call it, but now we do. So as you've seen today, you have the commitment of Partnership Health Plan in order to make this available to their patients and to really become part of a service delivery network. And then you have incredible clinics such as Open Door, to the primary care provider side, who have invested their own personnel in order to say, listen, we need a dedicated coordinator. We need to make sure people are coming to their telehealth visits. We need to make sure that the technology is there. They've made a dedication to it. And then obviously from the Telemed2U standpoint, we provide the medical specialists. And I think you have to understand each one of these has an important role within the ecosystem, and it has to continue. But I think one of the biggest mistakes that's made, if I made the next slide, is that everyone just looks at the box, right? When you're talking about, I want to start telemedicine, everyone forgets the importance of the ecosystem and just concentrates on the technology. And as Dr. Hunter said, when we started doing this back in 2002, there wasn't even broadband. We were doing something called ISDN, which was 6 telephone lines tied together. And we used to, I think, somewhat kid ourselves saying that we were getting 12 frames per second. We were probably getting more like 8 or 10 frames per second. But even back then, with Dr. Nesbitt, it was never about the technology. It was about the doctor-patient relationship. And that's one of the things that I can't stress enough, that telemedicine is the delivery of healthcare. It is still the doctor-patient relationship. It is still the importance of the quality of the physician and the quality of the healthcare they're delivering. The telehealth, the technologies, they're just a tool, right? The technologies continue to evolve. And that's not to take away from anyone. I mean, SafetyNet Connect has a wonderful platform, but I know their platform's going to evolve and grow, and it's going to look very different in a few years than it looks now. But it's not just about the technology, it's about the connection. And for those clinics who are looking to get started, the business case is incredibly important because telemedicine can't be grant funded as a whole. There has to be a sustainability model to that. The grants can be one part of the initial onset of getting involved in telemedicine, but it has to make sense from a sustainability standpoint. I think that's crucial. And secondly, all the commitment from the individuals we spoke of before. And then you layer in the technology. Technology simply is a tool to achieving what we need, what our primary goal is, and that is the delivery of good, essential health care and making sure patients have access to the medical specialists that they need. So that's all that I had to say. So I appreciate the opportunity and happy to answer any questions.
Great. Thank you for bringing us back to the mission and purpose of all the work that you're all doing. We do have 2 questions that have come in, so I'll read them off, and any one of you 3, I'd be happy for any one of you 3 or more than one of you to answer. First one is, do you have experience, I assume this is for actually specifically for you, Dr. Siddiqui, do you have experience consulting with specialists from other countries besides the U.S.? So anything about international telehealth opportunities?
Absolutely, we do. When I was at the University of California, Davis, Dr. Jim Morrison, who is the closest thing to the patron saint of pediatric infectious disease, to the pediatric telemedicine there is in the state of California. Dr. Morrison had multiple programs throughout the world. As an organization, Telemed2You, we have an international program as well. There's definitely some issues with doing international telehealth. It depends on exactly what country you're working in. Those are not insurmountable, but just to let you know, there are specific issues with doing international telehealth. But it's a very viable program. And again, whether you're providing care to the distant side of California or halfway around the world, I think the philosophies that we've spoken about today are the same, but there are some specific nuances to international telemedicine.
Great, thank you. And one more question that's come in, and then I want to bring all 3 of you back to the business case interest and see if you have any other comments for the audience on that, since that was their main topic of interest. But before we get to that, one more specific question: why do so few dermatology eConsults result in face-to-face or the live telehealth visits? Is it because these eConsults include pictures of the patient? You know, that is, it's a store and forward type transaction, or asynchronous encounter?
That's an excellent question, and I apologize for not clarifying that. With dermatology, there's always pictures associated with it, and we follow the guidelines set forth by the American Dermatology Association with regards to the quality of the pictures, how the pictures are taken, how they're labeled, etc. And so, yes, so for the dermatologist, there's always a visual along with the history, and with dermatology, they're able to answer the question the majority of the time. Dr. Hunter, please.
Yeah, that's true. Because we sort of know which cases are going to be able to, we just want a diagnosis of a rash or a skin lesion, and those are the ones we send pictures to the dermatologist. If they have some kind of skin cancer or skin and need some kind of procedure, then we don't. We send them, we don't use this format, of course. We either do it ourselves or send it to local plastic surgeons, or get one of our dermatologists to do the procedures. So that it is a store and forward deal that we're doing for.
Hannah, were there further questions?
Hi, there's one more question.
It says, how do you incentivize your participating specialists? Money, time blocked, etc.
Oh, sorry. I was asking the question above that, and I was on mute. I'm very sorry. Is there? So let's do that, and then we'll circle back. So yeah, how do you incentivize the specialists?
Well, I think that one, medical specialists really enjoy telehealth because it is a new platform. It is a new way of delivering healthcare. I think not every physician is a telemedicine physician. You have to understand that. There are certain physicians who, one, need to have good communication skills, two, understand the medium, and are able to work in the medium. So for us, we go through a very specific screening process and then a specific training process to choose our physicians. Because again, and I keep saying this, and this is not a detriment to anyone, it's just the reality of it, not every physician is a telemedicine physician or a telehealth physician. You can't just stick someone in front of a camera and go, okay, practice medicine. They have to understand the medium, its positives as well as its limitations in order to be able to do that. So what stimulates our medical specialists to provide it is, one, working with the medium, understanding the technology, being able to do something that's very different from their routine work. And then, yes, there is the economic benefit of it. It's not the only reason. Our physicians have to be compensated for their time and their effort because they're just trying to make a living just like everyone else. So, but it's never about the compensation. It's about the collateral aspects of it. And I think that's been really important for us for the specialists that we choose. They enjoy being able to bring their specialties to areas where there isn't a specialist. Our psychiatrist that specifically works with Open Door has told me on several occasions how much she never realized that there was such a need there, and it really does bring her back to why she started in medicine to begin with, and sometimes that's lost with filling out paperwork and working on EMRs and doing all the mundane aspects of it, that it really is getting back to the true core aspects of medicine, and that is increasing access to care and the healthcare delivery aspect of it.
Great, thank you. There's one more question. I'm sorry I let there be silence for a moment there. Was there a measure by partnership of patient satisfaction pre-post telehealth? Specifically wondering about patient perception of access. Kelly, you showed us the numbers. You showed us the time from request of appointment to date of the actual telehealth visit, and it was 8 days or less for all the specialties that you showed. Wondering if there's any information from patients themselves about that.
You know, that's a great question, and that's kind of a piece that we're missing that I think we're going to be looking to in the future to survey our members that have received telehealth services. But as of right now, no. I know Telemed2U has surveyed patients in the past when we first started the program as well, and we received great feedback from patients that were happy to receive the care and not have to, drive distances to see specialists for that 15 to 20-minute appointment. But it's something that we're looking at doing in the future.
Great, thank you. There's a couple more questions I want to get to that are related to business.
The last question, if I may.
Quickly, if you'd like, sure.
Sure. We've surveyed, as Kelly said, we've surveyed a number of patients throughout our telehealth program, and I can tell you from on a 5-point Likert scale, our patients usually are our responses are usually 4.75 to 4.85 with regards to the patient satisfaction for the telehealth services.
Great, that's good data to have. Thank you for sharing that. Let's see, there's a question here about who's paying for the service. Does partnership pay telemed to you? And then they ask if Open Door can use the service for uninsured patients, and if so, who pays? I think from what Dr. Hunter said, that last part, Open Door is only able to offer the telehealth service to partnership patients. Is that true?
Yes, so our contract is directly with Telemed2U for the specialty services they provide, but for the eConsult platform, it's only for partnership members at this time.
Okay, great. And then is reimbursement for a, oh, go ahead.
Oh, I'm sorry. I think it's also worth acknowledging that one of the ways that Partnership Health Plan is really committed to telemedicine is that they've waived the prior authorization process for telemedicine. And also any copays associated with telemedicine. So we're able to see for example, the partnership patients from Open Door are able to see Telemed2U medical specialists without a prior authorization, and so it definitely speeds up the process.
That is a good service. Is reimbursement for a dermatology eConsult done more like other eConsult visits, which can't be billed to Medi-Cal, or as a telehealth visit, which can be billed to Medi-Cal?
We reimburse the specialists for their consult. The primary care site does not get reimbursed for the time they.
Right. So in this model, it's not billed through. It's not a direct bill through Medi-Cal, but it's paid for by the Medi-Cal managed care plan that you are.
Yeah, we reimburse the specialists.
Okay. Let's see if I can get to this one last question. Oh yeah, let's do it. One last question, then I'll wrap up quickly. Do your specialists, so for Dr. Siddiqui, do your specialists also see regular face-to-face patients in their own practice, or are they solely doing eConsult?
No, thank you. That's a great question. All of our providers have traditional bricks and mortar practices. Telemedicine is part of what they do, and I think it really augments their commitment to it. So yes, they have their traditional bricks and mortar practices, and then they dedicate time to Telemed2U to be able to provide telehealth services.
Great, thank you. All right, thanks for all those great questions, everyone. Really appreciate the discussion. Please look to the California Improvement Network website for other resources, including a recording of today's session that will be available in about a week that you can share with colleagues. The other two virtual encounter webinars that I mentioned at the top of the hour on portals and texting. If you want to read, for example, a really good case study about how a dermatology eConsult, like we've been talking about in this discussion, how that really helped a woman diagnose cancer in her arm really quickly and get treated, search telemedicine and technology at chcf.org. There's a lot of good resources, including that good case study and other research that's been done, reports over the years. There is a medication-assisted treatment webinar series that's available. You can sign up for those through the CIN website about the people who are really working to turn the tide of the opiate addiction epidemic. Those are getting over 100 people each webinar, really popular. There's also things like partner meeting reports when the CIN 15 partner organizations come and talk about important topics in healthcare, including partnerships between primary care providers and community resources to improve health of their populations, and one coming up in probably 3 weeks. It'll be published about payment models, MACRA, APMs, ACOs, capitation, all those models. It's a really good primer for that coming out of a meeting that happened at the end of February. If you've not joined yet, if you're not receiving the CIN newsletters with all of these resources yourself directly, please do join the CIN by clicking the sign up button. You'll see there those in the blue circle, the lower right hand corner of your screen. There's a sign up button. Just put your name and email down, and you'll be able to receive emails about all these different resources that are offered through the California Healthcare Foundation's California Improvement Network. And with that, at exactly the top of the hour, I want to thank once again our three speakers for sharing their exciting and productive partnership for their patients and to help them operate better as healthcare organizations. And thank all of you for your time. And have a great rest of your day.
Okay, thanks, y'all.
Thank you.
Thank you, everyone.